Hello, Assalamualaikum warahmatullahi wabarakatuh. My name is Izzah Irdina Binti Husni. Today I will be presenting about learning from experiences that you assigned to us. So the safety health and officer that I interviewed is Encik Zulhelmi bin Muhammad. He is an assistant medical officer since 2010 until now, and in 2018, he became a safety and health officer at Hospital Tunku Azizah, or also known as Women and Children Hospital Kuala Lumpur. So these are some of the education background. First, at 2007, he further studied in Diploma of Medical Assistant at College Pembantu Perubatan Ulu Kinta KKM, and then in 2014, he furthered his study in Bachelor's Degree of Occupational Safety and Health Technology or Technician at University Malaysia Pahang for 4 years, 2014 until 2018. And then on 2019, he furthered his study in Master of Science, Industrial Safety Management, Industrial Safety Technology Technician at UKM or University Kebangsaan Malaysia. Okay, these are some information about him that I managed to obtain. So he wants a trainee, a health safety security environment trainee at RP Chemicals Sendirian Berhad on 2018 for around 8 months. And then some licenses and certifications that he had is internal auditor that he obtained on 2017, and also Sijil Bengkung Merah Silat Seni Gayung Malaysia. So some of the benefits of having occupational safety and health practitioners or officers in workplace. First, it helps to increase productivity of the workers and therefore can benefit the company. This is because the workers, they are not scared or worried about their security, their safety, and also health when they are working. Therefore, it can increase their productivity and benefit the company. Next, it helps to increase workforce morale and also reduce the employee turnover, meaning the company can reduce the number or percentage of employee that leave the company or certain organization. Therefore, the company didn't have to give out a lot of money or their time to find or to hire new replacement and to train them. Also, it helps to save companies money, meaning can prevent or at least lower the injuries occurrence in the workplace from occurring lah. Meaning no need to pay for the workers compensation or to pay for the hospital's bill. Okay, moving on to the duties of safety and health officer. So I listed about 9 duties. The first one, help to advise the employee or anyone with high positions on actions that can be taken to ensure the safety and health of all the workers. As HO, we can advise them, but we need the black and white evidences. We cannot simply advise them because in case there's accidents occur, so we can prove that we already advised them. It's their responsible. They didn't follow what we already advised them. And then second, we can develop policies and plans to reduce risk of hazards in the workplace. We need to review existing policies and measures, and also we need to update according to the updated legislation. And then third, monitor and assess hazardous and unsafe situations in the workplace. Meaning as HO, we need to conduct workplace safety inspections, such as the installations made, the maintenance, the equipment. We need to do maintenance if it's not good anymore. And then disposal of the substances, we need to inspect equipment such as portable electrical equipment, especially because in the workplace we use this electrical equipment the most. And then we also need to observe the workers to ensure that they follow SOP, the safety procedures while they are working. And then ensure employee safety training, classroom lectures, demonstrations, and also hands-on instruction. Okay, this is because we cannot observe the workers for 24 hours, so we need to expose them to how to work safely, and we also need to educate them. So so that they can work safely. And then number 4, develop actions to assure the safety and health of all the workers. So we need to conduct risk assessment and enforce preventive measures in the workplace. And then we also need to ensure proper storage and labeling hazardous materials, proper waste management. So as we all know, in the hospital, where Encik Zul helped me work, they have a lots of chemicals and also waste management such as clinical management and etc. Next, investigate any accidents that have occurred in the workplace. If there's any accidents, we need to record and investigate them. We need to determine the causes and handle the workers' compensation claims. If we already know the causes, we need to do preventive measures to prevent the accidents from happening again. And then we need to prepare reports on occurrences and provide statistical information to upper management. Number 6, help the employer and safety and health committees in the office in terms of organising occupational health and safety programs based on Section 11 of OSHA 1994. Okay, we need to do the HSE plan, such as emergency drill exercise, trainings, lectures that are related to occupational health and safety, and even go to Royal, for example, to clean up the cafe and something like that. Number 7, make, analyze, and always update the statistics of any accidents or occupational health and safety related occurrences in the workplace. So we can put signboards of safety first, or maybe we can make posters that are related to health and safety. And then maybe, for example, we can put it in the lift. So while the workers are waiting for the lift, they can read about the safety and health posters. We can also put the statistics in the report. Okay, number 8, prepare a report based on Section 19 of OSHA 1994. And the last one, we discuss the report that we prepared with the employee or anyone that are in charge of the company reports. Okay, so I asked Encik Zul Helmi, why did he choose this career field when he already a medical assistant medical officer. So he said because of peers influence, because many of his seniors, they resign as assistant medical officer to become SHO at oil and gas company. So he was very curious. But yeah, SHO in oil and gas company, they have high salaries, right? But the riskier the job, the higher the salary. So back that time he was curious, and then he followed the hospital's requirement because HKL, they required a SHO as per regulation. So as he was curious, so he volunteered to further his study in OSH, Occupational Safety and Health Technology or Technician at UMP, and finally he joined this field. Okay, next, I asked him what are most unforgettable or memorable experiences in managing safety and health at the workplace that he ever experienced. So he said once okay, now we are in COVID-19 pandemic, so he's working at the hospital. So one time he need to handle the hospital staff, but that staff few staff, they had close contact with other staff and also patient that are positive COVID-19. So they need to do the swab test and quarantine for 14 days. But that time they have shortage of staff. So those staff that are waiting for the swab test results, they need to the SHO unit. They need to shorten the quarantine time because they are not enough time. They are not enough staff that time. So these hospital staff still need to come, even though they are not okay physically and mentally, because of course they are worried of their health, whether they have whether they are positive COVID-19 or not, right? So Encik Zulhelmi said as HSO, he was sad to watch his colleagues to go to work even when they are not well. But yeah, they are all frontliners, right? They are the backbone. So next, I asked him, did you ever encountered any violation of occupational safety and health legislation? So he said, Yeah, he did. He did violated the Section 15 of Occupational Safety and Health Act 1994. So once the building owner failed to do maintenance on the ventilation, so the indoor air quality in the building was poor. So that's problem arise. So the owner of the building was charged by DOSH, Department of Safety and Health, but the case was not further to the court because the building owner managed to settle the problem within the notice given. Okay, so next I asked him, what do you think the challenges as safety and health officer? So in his opinion, he thinks some of the challenges that he faced and we might face is to advise the upper management um, related to the safety measures of the to maintain the health, safety, and also welfare of all the workers. For example, he said the especially the allocation of the annual budget for occupational safety and health. You need to do trainings for the workers. For example, to do trainings, and also for him as he is working in the hospital, the budget is for to get a supply of good quality of PPE, personal protective equipment. So this PPE is very important as he's working in the hospital, especially now during this pandemic. So he said these are one of the hardest challenges that he need to face. Okay, I think that's all from me, and as some of the interview content that I made with Encik Zulhelmi. That's all from me. Thank you.